Hi, Dr. Moore here. I want to talk with you about autoimmune disease. Now, you may be familiar with people with rheumatoid arthritis, Crohn's or ulcerative colitis, Hashimoto's, psoriasis, multiple sclerosis, type 1 diabetes, vasculitis. There's a bunch of autoimmune diseases just ruining people's lives. But there's 3 stages to those. So you may have one. You may be in one of these stages and not really know that you're on your way there. So there's 3 stages. There are 3 stages to autoimmunity. The first stage is what we call the silent stage. And this is about 5 years in duration. What it really means is you have built up an antibody to a foreign protein. And so we can detect those antibodies. Now, you don't have any symptoms, you feel good, no big deal, I'm good to go. Then there's stage 2. And stage 2 is what we call reactive autoimmunity. And that is when you start to get those symptoms. For instance, if you had ulcerative colitis or you had rheumatoid arthritis, your hands would be stiff, your digestive system wouldn't feel so good, but it would be off and on. And so it's oftentimes ignored. And that lasts about 10 to 15 years. And then that becomes stage 3 autoimmune disease, and that is tissue destruction. Finally, we can diagnose you that you have rheumatoid arthritis because your hands, instead of looking normal like this, they're all twisted and all aggravated like that, or I can't even do it personally on the video. But you got these weird looking hands. Oh, okay, now you get rheumatoid arthritis. Well, there's nothing much that can be done after that. But there is something that can be done when you're in stage 1 or stage 2. We can do early detection. We can do blood work and find out, do you have the antibodies? Because you have the antibodies all 20 years. And so if we can find the antibody, find out that you have the antibody, that you are on your way to this tissue destruction, we can then find out through other testing, is there a barrier breach? Is in your lungs, in your digestive system, in your brain? Or stuff getting into your body that's not supposed to be there? Is there a foreign protein that you have a sensitivity to? Is there a food sensitivity you have? Is there a chemical sensitivity? Is there a tick bite? Is there a parasite? Is there a bacteria? Now, what is the trigger that will aggravate this autoimmune disease and carry it along that pathway? Because if we can stop the triggers, we can stop the progression of the autoimmune disease. And that is how people do very, very well in our office, and they get it under control. I'm Dr. Robert Moore. You can call us at 810-374-0304 for further information. And then I'm just going to talk with you about one test that we can do that tests for 24 different autoimmune diseases from the top of your head to the bottom of your feet, covers all your systems. That's how we do the introductory, do that test, and then we decide what do we need to do next, the barrier breach and sensitivities and stuff like that. Again, I want to thank you for watching this video. Have a blessed day.